My name is Rob McKelleher and I'm Program Manager for AusAID's Australian Leadership Awards Fellowships Program. The ALA Fellowships Program is a component of our Australia Awards. It's a competitive grants program that was established in 2006 to develop leadership, to address our regional development priority issues, and to build partnerships and linkages between Australian organisations and their partner organisations in developing countries.
I'm Therese Mills. I'm the Assistant Director General for the Scholarships and Volunteers branch in AusAID. The really good thing about the fellowship program is it not only builds linkages between Australian organisations and counterpart organisations in developing countries, but it enables links to be built between developing countries themselves. For example, the Australian Red Cross hosted a Pacific Transfusion Leadership Program which brought out 10 fellows from 9 developing countries in the Pacific Islands. Some of the feedback from those fellows from the Pacific Islands was that they were really grateful to be able to share knowledge and experience across Pacific Island countries, and those networks are continuing and building and strengthening even long after the fellowship program has ended.
AusAID funding only goes towards the In Australia component of the program, and it covers things such as the international airfares to bring the fellows out to Australia. It covers any domestic travel within Australia to take the fellows from perhaps their course in Melbourne to perhaps a seminar up in Sydney. It covers their accommodation costs, their per diem or living allowances. It covers their medical insurance costs in Australia, and there's also support there for people who may have a disability to provide some assistive devices or some additional assistive care.
I'm Tony Stewart. I'm a medical epidemiologist here at the Burnet Institute. Burnet's had ALAs from a number of different countries in the Asian region, so Nepal, Burma, Laos, Solomon Islands, Afghanistan, and it's a real opportunity for us to be able to develop stronger partnerships with those countries in a way which we can't do through the normal delivery of programs within country.
Malaria continues to be one of the priority health issues for Nepal. So this fellowship program will bring in district officers who work in some of the malaria-prone districts in Nepal to undertake some professional development training. The intent of the training is for these fellows to acquire some new skills and knowledge which will help them back in their districts to deliver effective malaria control measures.
My name is Indira Yadav. I am working in Sirha District Hospital as a hospital nurse. I got a great opportunity to learn about public health programs and sampling method, research methodologies. I will apply to create knowledge among people about malaria, how it can be prevented, and the treatment, how can they approach to treatment.
My name is Kiar Singh Godal. I came from Nepal, district Chiton. When we go back to our country, this all thing is apply in our daily work, and also one project we will develop. One very doable and feasible project we will select, and that project when we go back to our community, we will implement it.
My name is Srijana Shrestha. I am from Nepal. I work in Ministry of Health and Population, Department of Health Services. My position is Public Health Administrator. I have learned a lot of things from ALA 2012 course, like research methods, planning DTP district planning, focus group discussions, and how to go manage the disabled people, equity. So many things I have learned. It's a wonderful experience, and meeting with the faculties with many specialization, that is a good part, because whenever we need, we can contact them and get information, even if we are very, very far from Australia.
I would encourage any organisation that's looking to apply for a fellowship grant to look on the AusAID website. We advertise fellowship rounds twice a year, and I would also encourage them to have a good conversation with their counterpart organisation in a developing country to really find out what the needs are and what the demands are from that developing country itself.
So applicants need to be able to articulate to AusAID the positive development impact the program will have. They need to articulate the leadership potential of the participating fellows. We also, AusAID, look at the linkages between the Australian organisation and the partner country organisation. And the last key issue is the capacity of the Australian organisation to deliver the program.
It's a really important part of the process to make sure that the best people are selected and they're able to attend. So there's a long period of negotiation and selection.
This is not a supply-driven program. We really want to be doing the best that we can to help alleviate poverty in developing countries across the world.